When we are extracting a root, there is a possibility of fracture of the roots or the root tip, or you might encounter a root tip on a radiograph. That's what this video is about. We are going to learn how root tips are extracted, and then we are going to learn when we can just leave them alone. So imagine you were extracting a tooth and the root of that tooth fractured. The tooth is out, but a piece of the root is still in the socket. What do you do now? You might think of getting a root tip elevator and immediately try to remove it, but that's not the ideal way to begin. So what should you do instead? Once the fracture has occurred, the patient should be repositioned in a way that you can get better visualization and adjust the light accordingly. Next, vigorously irrigate tooth socket and apply suction with a suction tip. Sometimes if the fragment is small and loose, it will come out with irrigation alone. So always try to use the simplest technique first and then move on to the more complex ones. So once irrigation and suction are done, we should inspect the socket carefully to check if the root has been removed. We should also check the extracted tooth to see how much of the root is fractured. If the root piece is not removed with this process, we should then move on to the next technique. In order to extract such root tips from the maxilla and mandible, double-angled root tip elevators can be used, because they have a sharp tip which fits easily between the root tip and the alveolar bone. We can place the narrow-angled elevator in between the alveolar bone and the root tip, and push it forwards as apically as possible. Then we can try to luxate the root tip until it is moving. If this attempt is not successful, that is, if the root tip is not mobile at all, then we should place the tip of the elevator on the mesial and distal aspects of the socket until the root tip is fully mobilized. Once it's moving, removal is very easy. An instrument called root tip pick can also be used. The root tip pick is inserted into the periodontal ligament space, and the root is gently teased out of the socket. But remember that it should not be used like an elevator because the tip of this instrument is very delicate.